And we'll now be turning to a group that often faces barriers to access, parents and families living with trauma or systemic challenges. Our next speaker is reimagining how physical activity can be delivered in community settings with equity and compassion. Dr. Francine Darroch is an associate professor in the Department of Health Sciences at Carleton University in Ottawa, Canada, where she leads the Health and Wellness Equity Research Group. Her research focuses on equity in access to physical activity, using trauma and violence informed approaches to support individuals and families who face these barriers. Today, she'll be sharing her important work in a presentation titled Designing Community-Based Trauma and Violence-Informed Physical Activity Programs. Please welcome Dr. Francine Darroch.
It's not, sorry, it's not, there we go. Oh, now we are ahead. Okay, I would like to first of all thank Dr. Korkor for having me here today. It's such a privilege to be here in this room and sharing this space with everyone. Those were two tough acts to follow earlier. I want to acknowledge that I don't have the dynamic nature of our last speaker, and also that I don't know any Nobel Prize winners, so I won't be referencing them in my presentation. So I want to start off with my thanks. So the work that I do is community-based participatory research. So it's truly a collaborative effort. We've had so many community partners that we work with, PhD students, organizations who kind of share and support our efforts to reimagine what physical activity can look like to reach populations that typically don't have access. So today I'm going to talk to you about a study that was funded through the Public Health Agency of Canada. And there was a call for preventing and addressing family violence. So the focus of this work was looking at gender-based violence and family violence. And our goal was to really leverage trauma and violence-informed approaches to physical activity to support individuals who have experienced violence. So I'm just going to briefly describe the three communities that we worked with. So two are based in Ottawa, Canada, and one is on the West Coast in Vancouver, British Columbia. So Banff Avenue Community House was our first partner, and they are a social housing community. So everyone that lives there is living on low income. It's a diverse and wonderful community, and they have wraparound services for food, food supports, and different type of social supports. They did not offer any physical activity or recreation programs for women. So Crabtree Corner is our second partner, and Crabtree Corner is an organization that supports pregnant and parenting substance-using women and women who are experiencing precarious housing. Again, an organization that didn't have dedicated physical activity programming. And St. Mary's Home is an organization that supports young, pregnant, and parenting individuals that are precariously housed and have varied experiences of trauma. So I think the context here is just really important to outline out front, that these are folks that are not already engaged in physical activity. So I think our first two speakers have already addressed why physical activity is important. And I think everyone in this room has a shared understanding that it is crucial to our mental and physical health. But what I would like to reiterate is why I think it needs to be trauma and violence informed. Again, we've talked about the statistics already this morning, but over 70% of Americans and 76% of Canadians will experience at least one traumatic event in their life. So any room or space that you're walking into, 3/4 of the people have experienced trauma. Again, I won't go into physical activity and the important impacts that's already been addressed. But what I do want to reiterate is the importance of reaching groups that are not typically reached. So there is inequitable access to physical activity and recreation programs for people who are precariously housed, living with low income, or have experienced trauma any type of trauma. So just so we're all on the same page, I'm going to start by just addressing what I mean by the 4 tenets of trauma, balance, informed physical activity. And then in the next part of my presentation, I'll talk about how we applied it and then some outcomes from our study. So, trauma awareness is the first tenet that we draw on. And this is really ensuring that people have an understanding of the impacts of trauma. So, part of this is really a lot of work that needs to be done in terms of understanding the population that you're working with, understanding the impacts of racism, of colonization, and how that impacts people's lives daily. It's ensuring that the structures that people are working in, where they're delivering physical activity programming, that the policies and the strategies of those organizations really align with a trauma aware approach. And I think one thing to note is that there's no one size fits all approach. There's such diversity in each community, and the needs need to be really understood before we start addressing program needs. So, the second tenet that we often draw on is taking a strengths based and capacity building approach. And by this, we mean building on the strengths of the individual person who may be attending the physical activity class or program, but also building on the strengths of the communities. So for us, it's really we try to employ people, individuals with lived experience in the community. We have a number of community-based outreach workers that are doing this work. Again, building the strengths of the community itself. So we need to have an emphasis on safety. So this safety means sort of physical, emotional safety, and also cultural safety. So it's important to ensure that spaces are welcoming, that people are able to access the locations of the services based on their kind of lived experience, and their safety within those neighborhoods. It's taking a non-judgmental approach. And then there's really practical things. So there's so many things that we could address at the structural and systems level, but then at the individual level. So people who've experienced trauma often don't feel safe in their own bodies, and can be extremely triggered in physical activity spaces. So no touching is a really good example of a strategy that people can take. So if somebody comes over and adjusts an individual that's not prepared for it, it can have, some really extremely negative consequences. Or when we use commanding language, when we're telling people what to do and we're not providing choices for them to engage. And then there's fostering choice and collaboration. So this is providing really clear expectations of what should be happening in the program. The predictability and letting people know how the class is going to run is super important for people feeling safe. Another element of consideration when we talk about this is ensuring that people have choices in the movement that they're doing. I think the last presentation was a really great example of that. Running on the spot, you can be going fast if you want to slow down, but it's really offering that up front so people feel comfortable in working with something that works for them. So that was a very, very simple overview. And I do have a lot of tools and resources that folks, if they're interested, I can share at the end. So what did this look like for us designing trauma and violence informed physical activity programs? So I just want to highlight all of these pictures have been used with permission from the participants in our study. So the key elements that I want to highlight of this this was a 5-year, pretty large study, so we can't get into everything. But I do want to highlight the process of developing the online trauma and violence informed training modules, the co-creation of the community-based interventions, and the advocacy and participatory work of creating change in communities that continues on today. So, at the foundation of this is really understanding the communities in which we worked. So, we had 3 main sites. And across each site, we had a community advisory board that was involved in every aspect of the project. So these folks were compensated for their time, and they had say in every deliverable that we had. We also had what we call a super community advisory board, where all of the community advisory boards would come together bi-monthly online, just given the geographic locations, to discuss sort of what was happening across sites and try and, problem solve or figure out what we could do better. We then engaged in 34 semi-structured interviews with service providers that were already working within these communities. And we conducted focus groups with 83 community members. So this was really crucial to developing the next stages of the work and informed every aspect of the training and the intervention. So as I mentioned, we had a pretty long process of getting to the point of developing our online training modules. So at this point, we worked with community partners, colleagues, and experts with, some people in this room that could really bring a tailored approach to the training. We concurrently, as academics, we, searched the literature and wanted to have the most a really evidence-based approach to doing this. There was thorough content development, and we had collaborative review process. And then we piloted and evaluated it. So this is available in 2 languages, our official languages in Canada, English and French. And we landed on having 6 modules. And so this is a bit of a choose your own adventure style. So each module builds on the other. And the first one was to really have a core understanding of, what's the purpose of this training? What do we want to do? The second one was focused on, given the call, which was around family violence and gender-based violence, was really to understand how gender-based violence can impact physical activity involvement. The next one was looking at how to actually deliver physical activity programming that can be supportive and providing people with an evidence-based, like so a lot of you in this room, to encourage people to actually take this approach. And then, we worked on the application of it, and we wanted to have really tangible tools that people could use and take away in action in their own communities. And finally, we have deep dive sections across these. So the training was around 4 hours. It's online. It's designed to be, people can start it and take a break and come back to it. So it's really, paced at whatever time limits you have. But we also had, as I mentioned, the deep dive component. So you could really become an expert in all of the different areas. As we link out to a number of academic papers, probably lots of from folks that are already in this room. So this is just one of the practical tools that we developed. And while I don't love, a checklist approach to implementing programming, I think they can be helpful as a starting point. And this is what our service providers asked for, and physical activity trainers were like, well, how do I even start? And so we wanted to consider things at an organizational level, consider physical environment, and then consider how the facilitator can take up and deliver some of this programming. So the next step of our work was co-creation of community interventions. So what we landed on across sites was that we would do 6 weeks of activity, so across a year-long time frame. And each block of activity looked different. So we had a very democratic process in the types of activity we did. So we had women in the community who were taking part vote on what activities they would like to try across the year. And then our team sought out trainers to deliver the programming. And so once we had a trainer, we provided the trauma and violence informed training. They met with our team members, and it was a very iterative process of them delivering programming, connecting with us, and then going from there. So another part of this, and I briefly mentioned this earlier, was the idea of creating safe spaces. So in two of our communities, we had space available within the communities. So there's a community center in the social housing community we worked with that we were able to use, which was really important that people could access, supports within their own communities to reduce the number of barriers. At one of our sites, there was no space or capacity in the building, so we had to seek out other spaces across the city, and we did this in partnership with the participants because we wanted to know where they felt safe accessing spaces, or what we could do to support them getting to and from programming. So, some other really important considerations. We were very fortunate that we had funding to do this and realize it's not feasible across all sites, but there are creative ways if folks need to access resources to provide to community members, and I'm happy to chat later. But we were able to provide a pair of running shoes to all participants the first time they attended. We provided sports bras, water bottles. We had snacks before and after programs, just because a lot of our communities experience food insecurity. And we were also able to provide sports hijabs. Uh, the second, and what I would say most crucial part of our programming, was childcare. Again, the populations that we were working with, the age range, childcare was a main issue. So we had on-site free programming, free childcare, and then we decided after a couple of sessions we should get the kids moving, and we did not have our exercise snacks in place at that time. So we started a kids running program and a youth basketball program. So it was programming to meet kind of most of the community's need. And again, the idea of having these safe and predictable programs. So each community had specific needs. In one of our communities, if women wanted to remove their hijabs, so we needed to ensure that the blinds were down because there were community members constantly walking by. In other communities, it was, ensuring we had somebody at the door to make sure that there weren't any men coming into the community center or into the space. So lots of, specific considerations. So the next part of our design process was creating tools that worked for community members. So we wanted to do a pre and post check-in. So every time somebody came to a weekly program, we wanted to kind of say, hey, how's your mood before? How are you feeling? We had a few questions, and then they would do the same on the checkout process. So this allowed us to sort of have numerous touch points with individuals. We also ended up tailoring after a couple of interventions where we used validated tools such as like the EuroHIS quality of life, and found that it really wasn't meeting the needs of our community members. And so we went back to our community advisory board and sort of said, how is this questionnaire working for you? How is it not? And they said to us, what do you actually want to know? They said, well, we want to know if this physical activity programming is having a positive impact on your mental health, your physical health, and your quality of life. And so they said, why don't you just ask us that? We said, that is great. So we ditched some of the validated tools and we created with community members. So just this sort of simple scale that we could use. Okay, so what happened? So the first tool I mentioned, which was the trauma and violence informed training, we designed this for people that were going to deliver physical activity programming as part of our research. But we realized, okay, if we're creating this tool, why wouldn't we make it free and accessible to anybody who may want to do similar programming? So we opened it up and we had 205 participants take part in the training, and 75% completed the follow-up questionnaire. So we had a pre and post questionnaire. We also did qualitative interviews with the instructors that delivered the programming, but don't have enough time. I'm happy to share that after. So we had a diversity of folks take part. So from research trainees, students, we had community or clinical service providers complete the survey. And what we saw, we were interested in learning about their knowledge of trauma and violence-informed approaches and then their application. So as you can see here, the pre-survey is the blue and the post-survey is the orange. That essentially across both measures that we were concerned with, people, became much more confident in their ability to sort of understand the knowledge about it or apply it in any context. So since this time, we've actually had up to 1,000 people that have accessed our training. So when we look at the intervention itself, we had over 250 people take part in the programming, and only 168 took part in the research. So again, the communities that we're working within, there is a lot of mistrust of researchers and research. And for us, it was really critical to say, hey, come to programming, you don't have to do the research. So we had a lot more people that took part. And so some of these other numbers here are just really touch points that we had. So we had close to, almost 3,000 touch points with women and their children across the delivery of the intervention. So the folks who took part ranged in age from 16 to 78. 72% reported being visible minorities, 54% were newcomers or refugees in Canada. 17% were living with a disability. 86% were primary caregivers to young children. All of the families were living on low income, the individuals or families, and 18% had accessed emergency shelter services in the past year. So back to the tool that we developed with the community in asking participants, what impact did this program have on your mental health, physical health, and quality of life? You can see that folks reported, so we used that scale. So between 7 and 10 was our high end of the scale that we're presenting here. But we had a huge impact, I think, on the people who took part. So 95% of women supported that they felt it improved their mental health being part of the program. Okay, so we also wanted to look at mood changes. So it can be really difficult to assess change over time in this type of research, and we often don't see a lot of impact. But what we found with our research was that mood increased by just under 1 point for folks who took part, which was a large effect. And the other important thing was that there was no significant difference between sites or the types of programming. So all of the groups experienced similar improvements. And I think that's a really big takeaway in terms of thinking about the types of physical activity. I think any type of movement that people will do can be really positive. And the final thing that I wanted to chat about was advocacy. So community-based participatory research is unapologetically political. So the goal is to have impact in community and to create change. So for us, we worked across our sites and asked them, what do you need to further advocate for recreation in your community? Again, there's a link here to the story map that we created in one of our communities. So a story map, do many people know what story maps are? Have you used them at all? It's a really, really great advocacy tool. And I have a brilliant PhD student, Maddie Shepard-Perkins, who did this work. And essentially what she did was she took folks in the community through walkthroughs. And she asked them to let her know what their barriers were to physical activity. So in this one community, for example, people would say there's no lighting. It's really dark in the community. We don't feel safe going out after, in the fall and winter, 5 or 6 p.m. when it gets dark. And they talked about, the overgrown fields and the like the basically places that could be used for recreation, but that were not maintained. And so she kind of took everything that they told her and tried to put an evidence base behind it that was, sort of a strategy that could be taken to policymakers and city councilors. So she went back to municipal data sets and available online data. And then she did also some mapping, so geographic information systems, and was able to sort of highlight and pull from data to show that indeed the community was underlit compared to what the standardized expectations are. She was able to show that there is no bus that goes in and provides access to the community. She was able to show that there's increased car accidents within that area, vehicle collisions, pedestrian issues. So again, it's everything the community knew and had been saying, but she actually put the evidence base behind it for them. And so we went back to the community and said, hey, this is what we found. And they, of course, were like, we know, but thank you for like just, providing the research behind it. And we created these maps that they then took to their city councilor, and were able to continue advocating for this type of research. For work to be done and improvements in their community. So I think when we think about sustainability and impact and commitment to community-based research and supporting organizations or communities and becoming more active, I think it's really crucial to ensure that our programs are accessible, that there's free deliverables for communities. For us, it was really important to create and promote advocacy tools for each community. We supported grant writing. So a lot of my brilliant grad students actually wrote grants on behalf of the communities to sustain programming. So in addition to the programming that we had, we were able to obtain another year of funding to keep all of our activities going. And I think we, tried to remain true to hiring and training community-based research assistants across all sites, and we continue to work with them today. And so these are just a couple links that I invite you to check out if you have any interest in learning a little bit more about the work that we do. As mentioned, this afternoon, as part of the discussion piece, you'll get a break hearing from me, and you'll get to hear from some of the participants that took part in our study. So one of the advocacy tools that the community wanted was like a mini documentary to really highlight the voices of the individuals who took part in the research. So I look forward to sharing that later. And that's it. I'm happy to answer. I think there's a couple minutes for questions, or no? No, perfect. Great.